So, welcome to RISI Talks. Good evening, ma'am.
Good evening, ma'am. Thank you. Thank you for this opportunity, ma'am.
Congratulations, ma'am, for achieving your CPPS and CPHQ credentials.
Thank you so much, ma'am.
So, we are really proud of your dedication and commitment. So,
Thank-
in this video, you're going to share your valuable insights with us. So,
Okay,
let's move
sure.
on to today's session.
Okay.
What is a change in your current practice after your CPHQ certification?
Ma'am, actually, my basic profession is nursing, and before 1.5 years, I was able to promote to quality. But when I went to quality, it was new. I was a novice there. I don't know how to start, where to start. There was I want a backbone to support me where I'm going to work with, because I can see a lot of challenges there, a lot of patient safety issues coming in front of me, and most of our team was like, we are working based on a traditional thing. We can understand my organization was running with the traditional things. So, I has got an opportunity to get into RISI. Then, support of Dr. Tenasar and his dedication and his every day, the way of taking lectures. There are a lot of organizations they are giving about CPHQ credit, programs they are giving. But when I really joined with RISI, I can see he explains each and everything very practically, so which really influenced me. So when if you ask me what is the impact of my CPHQ in my daily profession, I can see each and every day there is a lot of things. So for example, when a nursing is coming into this quality newly, most probably they will give you an instant reporting to handle with. So even in instant reporting, our data collection, everything has been changed after the CPHQ. Initially, we don't know what is meant by good catch, so which really impact on patient safety. So after I have been attending, even during the course itself, we started to do this good catch initiation from our organization. So we also felt that there is a lack of incident reporting from many of the staff. So sir used to tell that you have to analyze what is the reason behind it. So even sir used to tell you have to analyze the turnover time that is taken by each staff for doing the incident reporting. Maybe this is the basic cause why the incident reporting is getting lesser day by day. And then how much psychological support each staff is getting if you're going to do the incident reporting, whether it can be anonymous or not. These are all the basic thing that where a lack of incident reporting has been could be identified. So these really worked out for us, and we have started even a good catch initiation program. Every month we used to collect all the good catch people, and we used to reward them. And after that, there is a tremendous changes in our, especially we are concentrating on ICU. So there's a lot of changes, and even per month, like for per quarter, we received around 90 good catches. That really shows that how far the patient safety has been improved. So a lot of things, ma'am, not only in incident reporting. When we come to the project, we always imagine that there should be a fall, then we have to do something on that. There should be an incident, we are waiting for an incident to make something on that. So it's not actually like that. So it can be proactive. This is a basic understanding I got from CPHQ and from RISI teams and SARS classes. Everything can be proactive. Identify the risk, identify the what all the risk you can find in your area, and then you have to do proactively something. So if we talk about things, there are a lot of things, ma'am, that we can share on this one. Lot of impact. Really, honestly, I'm very, very happy that I have joined RISI. I was able to find RISI than other organization, and Tenasar's support and dedication. Even in the sessions, there used to ask any doubt at the end of the session. So those sessions were very useful, and we can find many of the experts among us. So we can discuss each other. It was very, very supportive, ma'am, and we have seen a lot of improvement in our clinical and also quality side. So the thing is that we are not working on papers anymore. We are working actually with the patient safety, improvement of patient. Quality improvement is, we see it.
That's really nice, ma'am.
Yes, ma'am.
Ma'am, do you think whether these credentials, CPPS as well as CPHQ, it is really needed for the nursing professionals?
Yes, ma'am, of course needed. If you see nursing, she is a very important person of a multidisciplinary team, ma'am. Without a nurse, I believe that without a nurse, an hospital cannot run. Even you can run a PHC with nurses without a support of doctors, but you cannot run a hospital without the nurses who understands all the perspectives. She can understand a physician perspective, she can understand a physiotherapist perspective, she can understand a social worker's perspective from the pharmacy side. She's the center of that hospital. So she knows more. I strongly believe she can understand a quality perspective more than anyone. So for the nurses, it's very important to take the CPHQ. If you are really interested in quality, it's very important to take CPHQ and CPPS, where you are a midline to be a part of every multidisciplinary team to connect to quality. And I believe that CPHQ and CPPS is bridging now. So whatever you learn from CPHQ as a quality initiative, you can, when we also understand from the CPPS, we can implement all those quality initiatives of CPHQ, and you can implement the CPPS patient safety clinically, we can do it. So it's very important for nursing to learn these things. This is very important to learn. They can take the opportunity to learn this. I welcome all my fellow people to join the team of Rishi, and then to get into this detailed insights from our Rishi team.
That's real informative, ma'am. Ma'am, what do you think about the current practice related with quality? Do you find any gaps in it?
Yes, ma'am. Actually, there are a lot of gaps. When I initially I came to get introduced about the CPHQ, I found that we were still practicing all the things are traditional things. There are a lot of gaps. Actually, there is. So when we come into the CPHQ, we found, oh, this has been in practice, which has to be corrected long years back. So this has been a new opening for us, and a lot of gaps. I can tell you, like even the projects we are doing, like most probably we are working on a PDCA projects only. So we don't know something called FMEA is there, which can be worked out proactively. So that is a new opening for us, and we don't know something called statistical method of projects can be dealt in patient, like especially in clinical areas. What our understanding Six Sigma or our statistical method of analysis can be done only in the industrial area. And there is less supportive organization that really gives you a detailed idea in the healthcare quality. So this is really helpful, ma'am.
That's nice, ma'am. Ma'am, now are you recommending these credentials to other nursing professionals?
Of course, ma'am. 100% I used to recommend this one, because I wish, like what I felt and what I'm undergoing, this kind of energetic thing after the CPHQ or CPPS. I would like to have whomever interested, my fellow people, especially in nursing, they can join and they can enjoy, they can understand this kind of knowledge, and they can implement in all the organization. Really, we see the patient safety improvement in our organization. And not only that, and being a group of people working in quality, we were able, before when I was new, I was even cannot understand some of the key terms what they're talking about. So we feel like, oh, why I'm here, like that. So after this journey of Rishi with CPHQ and CPPS, I can understand the things are opening to me. I can understand, I'm able to involve in many of the arguments, many of the suggestions. I'm able to give the suggestions. For example, even for an RCA meeting, before I was quiet in the RCA meetings. Now when they're inviting for an RCA meeting, the suggestions that, for example, if I give a suggestion, they feel that because after CPPS, we understand only awareness, teaching, we contact education people to educate, this is just a weaker action. It can impact, but very less amount. But when we understand, it's very important to implement simplification, standardization of any things that can really give a lot of big changes in the area. They really approve this ideas what we give them. From the director side, for example, a nursing director is attending an RCA meeting, he approves the final concepts what we give than others they give. So we can see a recognition from our side after these kind of courses, especially from Rishi team. That's I really recommend for all of them to join.
So that's great, ma'am. So finally, please share some tips to clear these credentials from your side.
Tips and sense, ma'am. First thing, if you're selecting Rishi itself and Dr. Tanasar's, the dedicated way, I can tell you that word always. The way of dedication that he is applying you to all of us, that itself you are succeeded already. When you join the team, you are already almost 90, like 75% you are succeeded. But where you can give yourself is, you have to dedicate, because the team is dedicated, the organization is dedicated where you have joined. So automatically you have to reflect that kind of dedication to them. So your first thing is your attendance is very important towards the sessions. And then if you do not understand any concepts, sir is always having an open book to answer any questions regardless of his time, busy, everything. And also utilize the experts that you are among you, because most probably you will have 20 to 25 members along your group. So many of them, most of them, 90% of them are working in a quality professional. So you can use, and you can ask them, we can have this kind of challenges. How do you deal in your organization? Maybe we are a similar facility of organization. They can give you an idea on that. And sir is always asking you to have a group discussion to he will ask you to give his ideas, and small articles he is asking to share in the group. So a lot of opportunity to get ourselves to get into more insights of quality now. And not only that, you can share the real time scenarios what you faced and how to get an ideas from others. There is lot of chance to improve ourselves in quality. There are a lot of open ways. If you knock out, you will open. If you don't knock and sit, there is no way to improve. So there is a lot of opportunity, especially Rishi is opening a lot of opportunity for us in each and every sessions. Not only attendance, second thing, try to have our own notes. That's very important. Not only just listening throughout the session will never going to help you. After 2 or 3 sessions, like for example, we have weekend classes, means after 5 days of classes, sometimes we used to forget. This is normal because most of us are family people. We have our own jobs, so we have a lot of gaps in our the day to day studies. So better to have your own notes. And someone, if they are not able to attend the classes, there is nothing wrong to share your notes with them. So you can share, and you can support them in their absence. Sometimes they are not able to attend, so that is very important. And to have your own group discussions among your people, among your group, it's very important to understand. If you don't understand, maybe you can ask in the next class. And especially sir used to share a lot of WhatsApp discussions. Then try to answer, and always answer with rational. This is what sir wants, because he doesn't want an answer just A, B, C, nothing. It doesn't going to work or going to help you in the exam, real exam. So he will always ask you to give the answers with the rational. What you understand really, please place it in your own words. So always give the answers with rational. That's very important. And whenever he is asking you to do the practice exam questions, please do it. And then if you have any doubt, he is always ready to support us. And not only that, all other professionals, all our team members of RISI was very helpful in organizing whole things. And even during CPHQ, Ramya ma'am and there was another ma'am. Also, she were all of them in total was very supportive for us. So that could be the thing. Attendance is very important. You taking your notes is very important. Sharing your information among your team is very important. And at most time is like you have to be very patient for the 6 months. And always sir used to tell one word: certification is not important. Certification we can get from anywhere. So it's all about how we are going to get to the core of the information, how we are going to utilize it. And ultimate is, sir used to tell the process wise and customer wise. We are here. There is a person called patient coming to the hospital, admitted that I will have some improvement from here. These hands will give me something better in my health, because he's coming out of pain. So out of this, there are a lot of frontline nurses working directly, putting their hands to the patients. So why God is giving this opportunity to work as a quality is, we have to find the gaps. We're a person where we find the gap between the process voice and customer voice. Where is the gap? How can I fix it? This is what very important. So make yourself dedicated towards the classes each and every day. So really you will see a lot of changes, and you will see an emerging leader of quality is coming inside you. I really felt it. I really enjoy that, and I'm really waiting for more to develop myself. That's why these are some of the tips. So this can really help all of them.
So the tips are really valuable, ma'am. So once again,
Thank you.
congratulations to you. So your achievement really inspires the other nursing professionals also. So thanks for your time. So today we are signing off for Rishi
Thank
Talks. Thank you.